artery, but what's happening is I'm not picking anything up. And that tells me that the artery is pretty much occluded, and the patient is confirming that.
Yeah.
It is occluded.
This is 100% included, this is 70% stenosis.
So we can not see, so this is the artery that we use. The only artery we do not compress is carotid for obvious reasons. So I'm not going to compress it, although it is already occluded. But we can see that this is the blood vessel. We cannot see any flow in the blood vessel despite the fact that I've reduced the PF down to 710, that is at power Doppler level. And I have increased the gain significantly, and I'm not getting any flow in the artery. The only thing more I can do is to do pulse wave and see if I can there we go, and we are still not getting much in there. So there is no flow in the carotid on the left side, which is impressive.
Thank you. I tried my best.
Somewhere the flow is going somewhere.